All right, so continuing our discussion of disorders of the adrenal gland, we're going to be talking about Cushing syndrome. So, uh, what is Cushing syndrome and what causes Cushing syndrome? This is going to be an increased secretion of cortisol. And so remember that cortisol functions as a stress hormone. It is most often portrayed on commercials as a really bad thing. However, it's a beneficial thing because it allows you to escape. It increases your body's function while allowing it to escape from a stress. Okay, so remember that cortisol oftentimes results in hyperglycemia and gluconeogenesis. Okay, it inhibits inflammation, and also prolonged activation and usage of cortisol can result in depression of your immune system. So, what causes Cushing syndrome? Well, Cushing syndrome is most often caused by iatrogenic causes. So this is pretty much due to administration of corticosteroids. So prolonged use or excessive use of corticosteroids can result in this Cushing syndrome, and really that's not a problem of your body. That is due to administration of it. But other causes can include adrenal tumors or pituitary tumors. So if it's an adrenal tumor, it's going to be directly causing an increase in cortisol secretion. If it's a pituitary tumor, it's causing an increased secretion of adrenocorticotropic hormone. So what are the manifestations of Cushing syndrome? So we see this appearance here, and really this is the hallmark appearance. Okay. So we oftentimes see obesity is a common example. And not only is obesity, but we see redistribution of fat. And so we see the fat redistributed right in between the shoulder blades here. This is oftentimes referred to as a buffalo hump. We can see the fat redistributed to the face, and so resulting in what is called a moon face, and then also to the abdominal area. Okay, so this abdominal fat is the worst fat to get, by the way. Okay, this can lead to muscle weakness, and this muscle weakness is due to the protein catabolism that occurs when cortisol is secreted. So remember that cortisol results in hyperglycemia, and it provides enough glucose to produce that energy that we need. And it uses fat stores and protein stores to do that. So really, it leads to gluconeogenesis, and this breakdown of protein leads to a breakdown of the muscle because that's pretty much all protein, and leading to muscle weakness because of that fact. Okay. So we can see acne. The acne is due to the suppression of the immune system, right? The suppression of the immune system, and possibly due to the increased presence of androgens. So we see stretch marks are also symptoms. So you can see these long purple stretch marks here, and that's due to just the area growing too fast, right? So oftentimes you see it on the shoulders of people who lift weights a lot, and they put on a lot of weight real quick, not giving time for their body to adjust, leading to stretch marks and damage to the collagen fibers. And this specifically occurs in the abdomen, in the breasts, and then in the thighs, because this is where the fat redistribution occurs. We see that individuals with Cushing syndrome oftentimes see bruising, and this is due to a decrease in thickness of their thin skin, right? So you have thick skin and you have thin skin. The thin skin gets lighter and it's more susceptible to injury and damaging those underlying tissues such as blood vessels and capillaries. So this can result in easy bruising. Okay. We get delayed wound healing just because we have decreased protein availability, and our immune system is not doing as well. Okay. We have osteoporosis because cortisol actually leads to increased breakdown of our bone tissue. And then we get decrease in intestinal absorption of calcium. And so not only are we breaking down or resorbing our bone, but we're also decreasing the availability of calcium from our diet, and we can actually build new bone tissue. So eventually, this decreased intestinal absorption can lead to an increased secretion of parathyroid hormone, which is a hormone involved in increasing blood calcium, if you recall. All right. And so we have some additional manifestations. Hirsutism. Hirsutism is abnormal hair growth, and they think that is because of elevated androgens found in circulation. They aren't completely convinced, and so more research is ongoing. But that is one explanation for that, because testosterone increases growth, hair growth. Now, the next manifestation, we see changes in menstruation in women. And so these changes in menstruation really are the result of abnormal gonadotropins, FSH and LH. And then the elevated levels of androgens. So androgens are precursors to testosterone. Reduced libido. This pretty much applies to men. So this reduced libido is due to the decreased level of testosterone. So remember that gonadotropins are affected by elevations in cortisol. And so if we remember that the main source of testosterone in men is due to testosterone production in the testes. And if those follicle stimulating hormone and luteinizing hormone are decreased, then testosterone production goes down. Now, all along those same lines is sexual dysfunction, because gonadotropins are going to be really wild. Insulin resistance, because really you're running at a hyperglycemic state all the time. Now, for hypertension, that kind of makes sense, because cortisol has direct effects on blood pressure. It increases blood volume. It increases urine retention, which increases blood volume. Increases sympathetic nervous system activity. All those things contribute to the hypertension. Edema is likely due to the hypertension. So if you increase the filtration force, the blood pressure, more fluid is leaking out of circulation, and the same amount is being resorbed, so more fluid is accumulating in the periphery. Okay, hypokalemia, because if you are increasing adrenal secretions, you are increasing aldosterone production. Okay, so remember that aldosterone increases potassium secretion, okay, while increasing sodium reabsorption. Okay, and we also see mood changes as a manifestation. How's it diagnosed? Again, patient history and physical examination, looking for any of those manifestations. Okay, serum adrenocorticotropic hormone and cortisol secretion. So this is mainly affecting cortisol, but can affect androgens and then aldosterone. Okay, serum glucose is you're going to expect it to be elevated, indicating hyperglycemia. Complete blood count, you might expect leukocytes to be depressed, so leukopenia could be found via the complete blood count. Blood chemistry, you're going to expect deviations in sodium and potassium. Urine cortisol levels, you're going to expect it to be higher. Again, osteoporosis was a manifestation of Cushing's disease, so you're going to be looking at bone density tests. Now you're going to be looking, if really these all indicate Cushing syndrome, you're going to finalize the diagnosis with imaging, CT scans, MRIs, X-rays to look for any tumors or weird growths. Okay. So how do you treat it? Taper off corticosteroids if you're on corticosteroids. Okay, so you don't want to just stop it, because then your body is going to be a lack of cortisol. But excessive corticosteroids delivery really can result in this, because too much corticosteroids are present. Tumor removal by performing surgery, pharmacological intervention by decreasing adrenocorticotropic hormone. If you decrease ACTH, you decrease endogenous cortisol levels. And so along this line here, so your body's likely still producing cortisol, right? Endogenous production of cortisol combined with an extra source of corticosteroids could be a bad thing, right? And then otherwise, it's just manifestation management. So such as things like the blood sugar, um, blood pressure, blood calcium, electrolytes. So, all right. So that's this audio lecture. All right. We'll see everybody next time.